Hi, my name is Emanuel Cruz Carrasco. I'm going to read chapters 28, Oncology, and chapter 29, Pregnancy and Childbirth. I'm going to begin reading the theory and exercises of chapter 28, Oncology. A. Neoplasm. A neoplasm is an abnormal new growth of tissue. Malignant neoplasm cancers are likely to spread and cause serious illness or death. Benign neoplasms do not spread and are less harmful. When speaking to patients, doctors generally say growth or tumor. You have a small growth tumor in the bowel. A lump or swelling is a collection of tissue or fluid which is visible or palpable, can be palpated or felt with the fingers. A lump may be due to a neoplasm, but there are other causes such as inflammation or fluid accumulation. Patients say, I have a lump in my left breast. Doctors say there was a firm, palpable mass in the liver. Malignant tumors are characterized by rapid growth and invasiveness. The tumor may invade local tissues or may spread to distant parts of the body. Metastasis. Neoplasms, which are the result of metastasis, are called secondaries, as opposed to the original tumor, which is the primary. You have the results of the scan back now, and I'm afraid they show that you have a small growth in the prostate. Fortunately, it appears to be at an early stage, and there is no sign of spread. So if we remove it, there is every chance of a complete cure. Note, to invade verb is to enter and spread throughout a part of the body, and this process is invasion noun. If a tumor is described as invasive, it has the ability to spread. B. Symptoms and signs of malignancy. The symptoms of malignant disease may be related to the size and location of the tumor. For example, a space-occupying lesion in the brain causes raised intracranial pressure and symptoms such as headache, vomiting, or visual disturbance. Tumors of the colon may obstruct blood the lumen and cause change in bowel habit. Other possible symptoms of malignancy include bleeding, pain, and weight loss. Case 55. A 33-year-old man presented to his GP, general practitioner, complaining of a painless lump on the right side of his neck, which had been present for about 2 months and was enlarging. He had been feeling generally well and had lost about 5 kilos in weight. He was also complaining of night sweats. He had no significant past medical history. C. Treatment of tumors. A tumor can sometimes be completely removed or excised by surgery. If this is not possible, for example, if it has already metastasized to other parts of the body, it may be possible to destroy it by radiotherapy or by chemotherapy. We can see Unit 42 for more information about this. When a cure is not possible, palliative treatment is given, which is only intended to relieve symptoms. Now I'm going to read the exercises of chapter 28, Oncology. 28.1. Complete the table with words from A, B, and C opposite and related forms. Verb, cure. Noun, cure. Adjectives, curative. Verb, excise. Noun, excision. Adjective, excised. Verb, grow. Noun, growth. Adjective, growing. Verb, invade. Noun, invasion. Adjective, invasive. Verb, obstruct. Noun, obstruction. Adjective, obstructive. Verb, palliate. Noun, palliation. Adjective, palliative. Verb, palpate. Noun, palpation. Adjective, palpable. Verb, spread. Noun, spread. Adjective, spreading. Verb, swell. Noun, swell. Adjectives, swelling, swollen. 28.2. The notes below are about the patient described in B opposite. Use them to put the sentences 1 through 9 in the correct order. To make the next paragraph of the case report, use Appendix 2 on page 20 if you need help with the abbreviations. OET 37.8 Celsius means on examination his temperature was 37.8 Celsius. A smooth, firm 3 or 4 of mass in air supraclavicular fossa. This means there was a smooth, firm 3 or 4 centimeter mass in the right supraclavicular fossa. Nodes 1-2 centimeters in diameter, palpable in both axillae and inguinal areas. This means there were enlarged lymph nodes in both axillae and inguinal areas. Oropharynx NAD. This means his mouth and throat were normal. P 100 minor regular, BP 112 about 66. This means his pulse rate was 100 beats minute regular and blood pressure was 112 about 66. CBS NAD RS NAD. This means his cardiovascular and respiratory systems were normal. ABD mass palpable 3 cm below L costal margin. This means on abdominal examination there was a mass palpable 3 cm below the left costal margin. CNSNAD. Examination of the central nervous system was normal. So those were the sentences in the correct order. 28.3. Complete the sentences. Look at A, B, and C opposite to help you. 1. Distant spread of tumor cells is known as metastasis. 2. Many symptoms of cancer, such as difficulty swallowing, are due to swelling. 3. The opposite of painful is painless. 4. A malignant neoplasm is called a cancer. 5. Tumors which do not invade or metastasize are benign. 6. Secondary tumors are those which result from the spread of a primary. 7. If a cure is not possible, palliative treatment should be given. 8. A swollen liver suggests metastasis. Now I'm going to read the theory of chapter 29, Pregnancy and Childbirth. A. Childbirth. The expected date of delivery, EDT, is the date on which a woman is expected to give birth to the child she is carrying, pregnant with. It is calculated by adding 280 days or 40 weeks to the first day of the last menstrual period, LMP. Childbirth is also referred to by doctors as parturition. Delivery is the process of helping the child to be born. A spontaneous vaginal delivery, SVD, is a normal delivery. If there are complications, the baby may be delivered by cesarean section, surgically removed. A full-term pregnancy is 40 weeks, divided into 3 trimesters. A baby who is born before this is premature. One born after 40 weeks is postmature. A baby who is born dead, for example because the umbilical cord is around its neck, is stillborn. A pregnancy may end before term spontaneously with a miscarriage, a spontaneous abortion, or be deliberately terminated with an induced abortion, termination of pregnancy. Note, the word induced means to cause something to happen. Labor. Labor. The process by which the fetus and placenta are pushed out of the uterus is called labor. It is divided into 4 stages. Some words which are combined with labor are premature, prolonged, spontaneous, induced, false labor. C. Presentation and lie. Fetal lie is the position of the fetus in the uterus. The normal lie is longitudinal, and the abnormal lie is transverse. Fetal presentation refers to the part of the fetus which occupies the center of the pelvic canal and which the examining finger feels on vaginal examination. Butterworth. The normal presentation in which the head, vertex presentation, bridge presentation means the buttocks are presenting. Bridge is an old word for buttocks. Abnormal presentation may require delivery with forceps. Here we have a photo of a forceps. Sorry for the text being mirrored in the video. So those were a photo of the obstetric forceps. Now I'm going to read the exercises of chapter 29, Pregnancy and Childbirth. 29.1. Complete the sentences. Look at A, B, and C opposite to help you. 1. A baby that is born a week before the EDD, or expected date of delivery, is premature. 2. A termination of pregnancy may be necessary for medical reasons. 3. The first 3 months of pregnancy are known as the first trimester. 4. Fetal distress in the first stage of labor is an indication for cesarean section. 5. It was a breech presentation and delivery was by forceps. 6. A miscarriage is another term for an spontaneous abortion. 7. The umbilical cord was wound tightly around the baby's neck and it was unfortunately stillborn. 29.2. Complete the table with words from A opposite. Verb, abort. Noun, abortion. Verb, deliver. Noun, delivery. Verb, induce. Noun, induction. Verb, miscarry. Noun, miscarriage. Verb, present. Noun, presentation. Verb, terminate. Noun, termination. 29.3. Dr. Bennett, an ACHO or senior house officer, is presenting a patient at a weekly meeting in the obstetric unit of a hospital. Complete the presentation with the correct forms of birth from 29.2 above. This is Clara Davis. She came to the antenatal clinic at 9 weeks. In her past obstetric history, she had a pregnancy when she was 18, which was aborted, and another one a year later, which spontaneously terminated. Since then, she has had 3 pregnancies. In the first, the baby was delivered normally at 40 weeks. In the second, she had an induction of labor at 39 weeks because of fetal distress. The third baby presented as a breech and was delivered by cesarean section. So those were chapters 28, oncology, and chapter 29, pregnancy and childbirth, of the textbook Professional English Used in Medicine, the theory and exercises. Thank you very much for your attention. So that was the video.